Hi, welcome back to House Healthcare Committee. Zachary Hughes, welcome. If you can introduce yourself and who you're with, and then provide your testimony, that would be great.
Good afternoon. I'm Zach Hughes. I'm the Vice President of the Board at the Vermont Psychiatric Survivors. And we're pleased to be here this afternoon. Madam Chair, committee members, I come to you because this is a very important topic. We talk about we call it peer certification, but whatever you want to call it, it's going to be new for the state of Vermont. I've been in the movement for in the peer stuff for like 24 years. We were kind of, we did our own training and stuff. So I wanted to so I also participated in the work groups that Wilda White put together. At the time, I was employed at Washington County Mental Health. I also used the opportunity as a stakeholder to be there. So, we ended up coming up with some stuff out of there. And we have reviewed the current draft, unless y'all changed it. And I will say that VPS is generally in support of it. We have some feedback. We're still going through it, and we will continue to send feedback. My understanding, it still has to go through a few more hoops, obviously.
Yes.
So that's good.
Yep.
Because there's going to be more feedback, I'm sure. But in the layman terms, we're pleased with the idea that people can continue to do peer work without certification necessarily. We're very pleased with that because we believe in flexibility. We believed in this flexibility since at least 2006 when we first started. I wasn't on the board at that time, but I worked alongside people there, including our former executive director, Linda Corey. And we believed in the flexibility that both sides should be able to exist. Particularly Linda believed in that at the time. I just want to pass that along. We're pleased with that. Likewise, additional feedback. I did mention at Mental Health Awareness Day, when I heard about Office of Professional Regulation oversighting, I kind of, winced. I've discussed my concerns a little bit in work groups. It's a new thing. We received reassurances from OPR that they would be completely flexible with whatever he came up with. But I was concerned because in the peer world, there's a lot of different things and questions I guess I would have. And BPS just wanted to submit about if some, legal repercussions, if one of the peers slipped up and did something that was against the unprofessional regulation or say ethics. We're not saying that they shouldn't be held accountable, but there is, I wouldn't want to see somebody get slammed because this would be a profession if this goes through. It's a new profession. So there's just this idea of, some of the people I work with are, they're not used to legal repercussions. They don't want to have to worry about it. They just want to do the work. And that's really what I would be saying. And I did receive, some assurances from OPR when we first met in the work group. Didn't know they were on the call as my concern. Oh, OPR is right here. So we had a nice, it's all good. But I just wanted to say that. And then there is, just flexibility. We want flexibility to continue. We believe that it can work. The other thing is that we are concerned about is and I've tried to talk about it, but because it's a federal issue, people want to shy away from federal issues for some reason. So there is an issue with people working who have Social Security. Okay. And in my last job, we had to basically think how to explain this. basically we weren't able to train them effectively, and I'll tell you why, you have to pay them. And if we pay them, they lose their.
Right. Yeah.
So we had to forego, which is really scary, some trainings because of this. Nothing mandatory, but really frustrating from a trainer. I used to train and I was very frustrated, and it was one of the reasons I left my last job. We weren't able to overcome that. And we still aren't. I talked to all the delegations with the exception of Becca in Washington. And they all know about it.
Right.
This is one of those things. So we're concerned about that, especially when they're talking about, wage, this idea of increasing pay, going up. Just when I brought this up, it wasn't very well, we weren't able to
Yeah.
say, anything, and I don't know, it may not be an issue, but something to be aware of. And otherwise, for right now, we are in agreement with the bill.
Great. So thank you for all of that. I will say you will have, I think, we're going to have a discussion. We may or may not vote it out today. If we do vote it out, you will have, House Ways and Means will be looking at it, and then it will have to go to the Senate. So you'll have time to have
And I
concerns.
will yield for any questions.
Okay. All right.
Yes, I have a few questions from
Sure.
your testimony. Thank you very much.
Thank
Your
you.
name is Zach?
Zach Hughes. Yeah.
Zach. What advantage does someone get by being certified? If I have a problem, I have to tell you, with it being flexible, like you say, only because we're letting folks decide whether or not they want to be certified. It's a $275 fee.
That's
What
the other problem.
advantage does someone get by being certified?
The only advantage that I could see is that other people with other professions would accept it.
Okay.
Well, no, the issue is, and I didn't really that, I think the issue for me, because I've had issues with this, because I don't know what that advantage would be, except that it is a track for certain people who want to be able to say, we went to school, I did this, or whatever, and it's good.
Okay.
I'm not in that track, by the way.
Okay, well, I mean, I agree with you. And to me, everyone, if we're gonna do it, everyone should do it. But that's for us to decide.
That's for us to decide, yes.
I just wanted to get
Of
your
course.
take on it. The other thing I would say, as being someone who's on Social Security for a long time, I think until you're 69 and a half, there's a cap on how much you
That's
can
correct.
earn outside of Social Security. It was
That's
like
correct.
$25,000.
Yeah.
Was that the issue when you
That's
trained?
correct.
So Wilda,
I'm sorry.
Wilda, thank you. Go ahead, Zach.
I didn't know.
This
that. Yeah,
was an issue where I worked. I want to be very clear.
yeah,
At a designated agency, I will state this, and you can say, people can say no, but they could go over to Washington County and talk to them. Because my position is, it's just a concern. I have a right to raise the concern.
absolutely.
And I appreciate the disagreement. I get it. We're gonna have that. But we are in support of it.
Yeah, okay. No, I was just trying to.
Yeah, and it's unfortunately, that is a federal issue. It is
Yeah,
not
right.
an issue the state
Yeah.
can work with.
Right.
Daisy?
Zach, I just wanted to say thank you so much for coming in here today and talking with us. It's really valuable to have your input. And I know it's not easy to come and access this room.
We need to widen the rooms.
Yeah.
We do. Yeah,
Yeah,
we do.
but thank you for giving your input and.
Thank you.
Psychiatric survivors as an organization.
Thank you very much.
Great. Great, thank you. So let's give Zach a couple of minutes to move to a better spot or leave, whatever you want to do, Zach. We'll be happy to help you. And then we'll have Katie come up and then we'll.
Yeah, I can get up.
Did you go forward or
I'll
not?
go forward. After.
Zach, do you want to, if Katie's able to testify from here, you want to stay where you are, it just might be easier.
Whatever works for you guys.
Okay, yeah, that works. Thank you, Katie. So we do have an amendment that we did discuss when OPR was here. And then it wasn't in the bill. So Katie is going to walk us through the amendment. It is on the website and it's what draft, Katie?
2.1.
2.1.
Let me see.
Great, thank you.
Here we go. Katie McGlynn, Office of Legislative Counsel. So when we last had a walkthrough of the bill and you heard from OPR, one of the comments that they had reminded this committee was that if OPR would be conducting background checks, that they need statutory authority to do so. They have that authority for a whole list of other professions, so we would have to add that. So this draft 2.1 has a new section 2 in it. It's highlighted in yellow. And this is existing law, and it goes through the responsibilities of the Office of Professional Regulation. And you'll see on line 10, you have these ellipses that show that there's language omitted. So this is where we have a big long list of other professions where a background check is authorized, where OPR is authorized to do it. And you would be adding subdivision J on line 13, peer support providers and recovery support specialists certified under 26 VSA chapter 60. So you're adding that to the list with this amendment. Really no other changes besides a few typos that the editors caught when this went through. Pluralizing the word dates and effective dates, changing people to persons to be consistent in one spot. And I believe that was it, maybe adding a comma.
Okay. Great. Does anyone have any questions on the amendment for Katie? I'm giving everyone a second to read it.
Not missing?
Huh?
You're not missing anyone?
What do you mean we're not? Nope, I don't think so.
Okay.
Yes.
Is criminal background histories defined in statute? I don't know, I'll have to look in Title 3.
I have a question. We're ready.
Okay, 1 second.
Is everyone quiet right now? Because I
Yes.
can't. Okay, I couldn't tell if it was
We are.
frozen and if I was missing. Sorry.
Yes.
It was one of those rare moments.
Okay, we're on. But we're Katie's looking up the answer to a question of whether criminal background histories is defined in statute today.
Yes, thank you. That makes sense. I just wanted to make sure it didn't freeze because you all got unusually still.
Yeah.
It's because you're not here, Brian.
It looks like the term criminal background histories is used about 2 or 3 times in this subchapter, but there's not a definition.
Okay, Leslie, your question.
So I'm also thinking about criminal background checks and the director, this is in, well, on page 8. Line 15, seek the advice of the advisor appointees in carrying out the provisions of this chapter. Does that imply that it applies to criminal background checks? Is that obvious? Because of this process that I'm learning about,
That that first sentence in subsection B.
Yeah,
doesn't apply to
that-
criminal. It
It could,
it could include it, and it's
Yeah.
not specifically saying that that is the topic that they're providing advice on. It's generally authorizing the advisor appointees to provide advice and the director to seek advice related to the profession.
so that would safely say that this process would be used in background checks in this profession.
It could, it gives the director authority to seek advice. So how the
say
director
yes.
uses that
Okay.
is up to the director.
Does that help?
If it's true, yeah.
Does anyone remember what the bill was we were working on last session where we talked? I feel like it was at length about background checks.
Well, it was all the compacts. We had to put background checks into all the compacts that we've been doing.
Back and look at my notes on that, because I feel like I had some similar concerns about background checks and just making sure that there was room to allow equity for life experience that actually brings value to the role of the job.
So I think the one thing to remember is in this bill, there is still a rulemaking process. And that can all come out in the rulemaking process as part of the
It can.
process. Right.
But does it, but I've never participated in rulemaking, so I don't know how that works. So can we count on that, I guess, how do we count on that?
I think if we state here that it's a concern, we can send our concern to OPR and they can talk about it as part of the rulemaking process. I guess I'm not sure. Brian, go ahead.
I couldn't understand what Leslie said a second ago, so I don't, you said you never participated and I heard like want, want.
In a rulemaking process.
Okay,
I just-
thank you.
I just want to secure that that is part of the rulemaking I want to feel confident about it, I guess.
Confident in
That it will
what?
be considered as part of the rulemaking process in this bill. I
That
know
what?
this feels a little different to me, but maybe not, just because of the peers who have had lived experience may be different. Maybe that's not fair. I don't know, I don't mean different, but if you know what I mean.
So are you saying that we should not require a background check?
No, saying that I want to feel safe that these considerations will be taken into account during rulemaking.
What considerations?
Okay, I think
I-
I can.
Okay, thank you,
I
Dane.
think I might, tell me if I'm wrong, Leslie, but I think what I'm hearing is that the discussion that we had earlier about considering the criminal background checks and whether or not that would be appropriate for certification or licensure, and that there was maybe some like verbal assurance from the OPR that they would include the advisory group in making those determinations on a case-by-case basis. But maybe it's not clear in statute that that would be like required. And so maybe the OPR could just make that call without including the advisory group as it's written in statute. So do we need to,
Jane.
do we need to spell that out?
Thank you, Jane. See, I knew I wanted to.
All right, so do we want to add something in under the advisory section?
Yes, I think it would be helpful. Yeah.
So Katie, I'm looking to you where that would go.
I'm thinking that the sentence that we were looking at before, page 8, subsection B, the first sentence. The director shall seek the advice of the advisor appointees in carrying out the provisions of this chapter, including specifically rulemaking provisions related to background checks.
Perfect.
I can come up with something over article, but
1 second, Rhoda. Daisy, is that
I think that's
proper?
How do we connect that with page 9? Line 9.
I didn't hear this.
So page 9, line 9 says, so under eligibility has past criminal history and registry checks as described in rule. How do we connect that with what we're going to put in 8?
We could cross-reference it.
Do you want to draft something and then we can look at it? Wilda,
Yeah, I was.
can you state your,
Wilma White, I'm here on behalf of the Peer Workforce Development Initiative, which is a statewide organization as the peer workers in the state of Vermont who are trying to enhance the peer workforce. I would encourage the committee not to include any thing about this, what you're contemplating for a couple of reasons. One is the language that's in the bill is tried and true and understood in reference to the existing statute is tried and true and understood, so we know what it means. The amendment that you're suggesting doesn't make sense because the advisors do not come on board during the rulemaking process. They come on board after the statute has been passed, after the rulemaking is complete. And the, Office of Professional Regulation, the stakeholders, the Department of Health have come together on this bill in a way that is really a delicate balance, and we have agreements about it. And I would hate to have something that you write coming in at kind of almost the 11th hour. One, upset that balance, and then two, no one understands what it means. Because if you put something in there about criminal background check, some people can interpret the statute meaning that that's all you wanted the advisors to do. And so I would hope that you would just trust the way the Office of Professional Regulation works with all other professions and leave it as it is. We have worked really hard with OPR, and we trust them. We've seen how this has worked in other professions, and we feel like we would be entitled to that same due process. And so I don't think it needs to have anything further.
So thank you, Wilda. So I will agree with your thought that putting it where we just discussed probably doesn't make sense, because you're right, it is, that happens after the rulemaking process. I will say that we can find another place to put it. I just want to make sure Leslie and Daisy still want to move forward.
No, I understand totally what you're saying. I was not thinking this would occur during the rulemaking process. I was thinking that the rulemaking process would include a process for including the peers. So sorry about my being inarticulate. But anyway, I hear what you're saying and I'm happy to withdraw.
Daisy, do you still want it as part of the rulemaking process?
I need to think about that because I don't agree that because we trust a certain office that we shouldn't put something in a bill. I absolutely disagree with that.
And Helen, you're agreeing with that? Okay, so Katie, is there a place in here that we could make our intent clear that it should be considered during rulemaking process?
Go down to our rulemaking section 5. And you could add a new sentence that in creating these rules, OPR shall consult with, you can name specific organizations, or you could just say stakeholders generally.
I mean, we have, what line are you looking at, Katie?
On the last page of the bill, section 5, and I'm proposing adding a new sentence.
Only
first sentence.
Recovery sports, but so we have the state standing committees, right? Are you part of that, Zach?
Yes.
Hesitant to recommend a specific committee. Tara? I know that there are.
The language
committees.
that it just used the word shall. The language that was in here was may inquire into the criminal background history.
Well, I'm sorry.
I think what I'm gonna do is I'm gonna say, we are gonna do OPR.
Idea.
Since they do this and they've had discussions that we've heard from Wilda, we'll reach out to OPR and we'll come back to this tomorrow afternoon.
Yeah.
Is that?
That's great.
That's the way to go.
Okay.
Yeah.
I think it
So-
makes sense, and I want to just support that. Like I want to be consistent between the ways we approach professions and not use this profession as a chance to go in a new direction. I don't think it's fair, to necessarily if that makes sense, so I'd like to hear from OPR and hear what they have to say.
Okay, great. So we will do that. Katie, if you can reach out to OPR with what we're suggesting and see what their things are. And we can, we have time tomorrow afternoon because we've already had our 7:21 committee discussion. So Claire, can you put this on tomorrow afternoon with possible vote? And I guess let's talk about the bill. So let's put that aside for a second. Based on the testimony we've heard, where are we on this bill? All right.
I asked OPR this question before, and my problem is this isn't a hard and fast thing. I support the bill. I support what we're doing. But I still say it should be for everyone. If we're going to do it, we should require everyone that wants to be a peer counselor to certify. And I understand why some will have background checks backgrounds that might be difficult to maneuver, but I would think in a rulemaking, we could account for some of that. I get that. I just feel like we're going to do this. I think there's I think we leave ourselves hanging a little bit, maybe. But if we're going to do it, we should do it like we do other professions.
So I appreciate that. I will say that I don't think there's a correlation between someone choosing not to get certified and what their background check might show. I think, there is a robust community of peer support and recovery support workers in Vermont now that are not certified. And I think we heard loud and clear last year or 2 years ago, whenever we took testimony on this, that there is a group of people who don't want to be certified. So we can see what everyone else says, but I feel strongly that we should keep it. You can choose to get certified.
What advantage do we get on by certifying?
So they are being trained. They will have a code of ethics. They will be able to bill Medicaid, and they will have ongoing training support.
Super.
I'm going to disagree with Larry here.
Oh my gosh, what?
I'm going to disagree with Larry. I think there's a lot of peer support people out there that do it now, not certified. They don't want to be certified. And I think every one of us has probably been in that situation where we've given help to somebody. So, are they going to say, oh, you can't do that anymore? You're going to get certified? So, sorry.
No.
And Dave, please feel free to jump in.
Oh, I see.
Yeah, this is the first. Any other thoughts, concerns? If we vote tomorrow, is everyone ready to vote tomorrow if we have this one extra issue resolved? Yes. 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 Okay.
It's a great bill.
Thank you, Dave.
Thanks, Dane.
All right, so we will be back to this tomorrow afternoon. We will work with OPR and get some, sorry, Bobby, get some language and. Bobby, stay right there because we're almost done. So we will get language out to you and get a response from OPR, and then we'll come back to this tomorrow afternoon. So we will be back we're on the floor at 3:00. Tomorrow, we're on the floor at 9:30, 15 minutes after the floor. We're here